Okay, welcome to my lesson on how to effectively explain the lasers and how to effectively close a person on the laser idea and that the lasers can help them to recover from their injuries. That's the most important thing, I believe. I believe when people come in for the laser, they're looking for immediate relief from chronic and acute pain. I think you should state that in the beginning that you've had a lot of good luck with that. And they're looking for an option besides pain pills and painful injections and waiting until having surgery. They're looking for help. And the beautiful thing about the deep tissue lasers are that they can achieve incredible results in you know half the time it would take for any other treatment. And sometimes where other treatments have completely failed, the high deep tissue laser has succeeded, where many other procedures have failed. And as people come into the office and they give you their description of what's wrong and the pain they have, you'll find out you always need to ask, what other treatments have you tried? What was your results? How many times have you had the injections? And how long did it last? Was it temporary? And what you're going to find out for most of the people as they go through this process is they have an enormous amount of suffering and no results whatsoever from the other professions. And they're here in your office because they're looking for help and they're looking for a new idea, something that's fresh, something that they believe is valuable. And it's your job to be able to understand enough about lasers and be able to explain to a person how this laser works, how it helps them to feel better, and why it's different than other procedures. You really, if they think it's the same thing as putting ice on their back, then they're going to just choose ice. If they think it's as effective as an injection or taking anti-inflammatories, then why would they choose the laser? It's really important that you've just discuss this with the patient and that they know that these other options haven't worked for them. And I think it's important because that's going to position them to be more likely to try your laser procedure. So I highly recommend you should always, when people first come in, you're going to be doing, they have no idea what to expect in your office. They don't know what's going to happen. They've been to other doctors that maybe have made them wait a long time. They have never really met the real doctor. They always meet the staff. And they also know it's expensive, that if they don't have insurance, most people can't afford it because they don't have the doctor's fees are so high. I think you have to really relate that when people first come in to put them at ease that this is a free consultation today that you've received, and what we're going to do here today is we're going to do a problem focused history, a problem focused exam, meaning we're going to look at the area you hurt, and that's what we mean by problem focused. And if I think it's necessary, we'll take some x-rays. And all of these x-rays at this point, I will look at the x-ray results. I'm going to look at your exam findings and your history, and I'll determine whether or not I think that the laser and the services we provide can be of a benefit to you. I'm looking for full resolution. I don't want to just treat the symptom. I'm really looking to be able to wrap this thing up for you so you don't have to continue to suffer. And all of this is at no charge to you. It's at my expense. And the reason why we do this is because, and I think people need to know this, because, why are you giving it away? If it's so wonderful and so many people love it and it's so effective, why are you giving them a free visit? And you need to explain to a person that the reason why you're doing it at no charge, at your expense, is that there's no information really available in mainstream medicine about these lasers. If you ask one of your friends at the golf club or at the dinner, at the luncheon that you go to, have you ever tried deep tissue laser? Most people have no idea of what it is. So there's not a lot of information out there. And oftentimes when you ask your medical doctor if you think it's a good idea, they don't have any information on it either. That's how new this technology is. So I know that the best way to get somebody to come in is to offer them a free exam and a free x-ray. and at our expense, of course. And then maybe I have a chance to explain this to you, and you can see if it's really something that you want to do. So that's why there's no charge for it, because I want to introduce it to you. And at the end of this exam today, we're not going to give you a treatment, but what we're going to do is we're going to look at the what's wrong, and I'm going to demonstrate the laser to you, and then I'll study the results, and you'll come back either tomorrow or the next day for your report of findings. And there's no charge for the report of findings. And if it's something that I think I can help you, you'll have a laser visit after the report of findings. Now, our average cost for a laser visit is between $75 and $150. It depends on the area and how long it's going to take. So if you wish to have a treatment tomorrow after your report of findings, please be prepared for at least one laser visit. I would also suggest that you plan on bringing your spouse or your significant other so you can make this decision as a family. This is important to your life and your health, and it's really hard to explain to our spouse how a laser works and how it's going to help you. And it's much better if you can get them to come in with you for that report of findings, because if I have to do it after the fact, then I'm going to charge you for that. The first one is free. The second and third one, we charge for that. So that's a really good reason to bring your spouse. So let's get started with your exam today. What we're going to do is we're going to have you fill out some patient information. This is standard forms of history and listing. Make sure you fill out the front and the back. There's some HIPAA forms in here which states that we protect your privacy. And then there's a very important form in there called a pain questionnaire. And the area that your complaint is you need to fill out a pain questionnaire. And these are numbers from 1 to 10 where you grade how often you've had the pain, how bad is it at night, how bad is it during the day, how do you rate, how it affects your work, your social. It's very extensive what they ask. And what you want to do is if you have more than one area, multiple areas that are a problem, like your knee and your shoulder and maybe your wrist, you're going to need to fill out separate pain questionnaires for each complaint. Okay, and once you get that done, we're going to get you right away into the exam area, and I will do my examination, and we'll handle it from there. Any questions? Great. So that's really the first part. What I do then is they fill out the forms, and I will lead them to the back, and I'll always let them know that your symptoms or this problem is very important to me, and we're going to go into that in just a moment. However, before we get started, I just want to give you a little tour of the office. I think it's important to make a person feel comfortable. This is where the bathroom is. If you need some water, that's for you there. These are some pictures of some of our testimonials of people that have come in for the laser and have gotten some great results, and that's why they're up there. They want you to know that you're making a good choice. These tables in here, these are the chiropractic tables. You may or may not need chiropractic services. I know you're here for laser, but I just want to let you know that I am a chiropractor, and this is where we do the healing, and the chiropractic healing takes place here. This area over here is where we actually do the laser therapy, and I'm going to invite you into the exam room, and let's get started on the exam. So what I would do is I would explain to them that I would ask them about their symptom and how long they've had it, and how, when it's at its worst, how would they rate the pain from 1 to 10. I would look at the records that you gave, and you would ask some of the questions about the pain questionnaire. And then you'd also ask about, could you tell me a little bit about prior treatment that you've had for this problem? Have you tried other methods? Have you been to other doctors? Have you tried injections? Have you taken pills? And what has been your response to those treatments? And you just taken all this information in, and then you examine the area, you touch it, you feel it, you do some range of motion, you tap it, you let them know that you know where that pain is. If it's something that's in the neck or back, you're going to do more of an examination of the spine. If it's in their elbow, you're really going to feel it. You're going to touch it. You're going to ask if they've ever had any pictures taken, if there's any x-rays of the area or MRIs. And if they say, no, I don't have any, I just been hurting me, you really need to take an x-ray of these areas. Do not assume that it's a simple strain and sprain. You always have to assume that it's a cancer or it's some kind of lesion, and you need to get a picture of that. Even if it doesn't show it, you need a picture. You don't want to ever have somebody shine the laser on somebody's arm, find out, 2 months later it's a gigantic cell tumor and it's in the arm bone and you didn't take an x-ray. So you're foolish if you don't take x-rays of every area that they hurt and they ache The medical doctor would take an x-ray, and it's something that's considered standard of care for doing this. You know, we fall into a trap of just shining the light on every spot that hurts, but you can't do that. You'll get in trouble with that, and we don't want that to happen. Plus, they expect you to be thorough and to realize that, you know, it's not something, everybody thinks they have a tumor or something. You know that. So I recommend getting an x-ray. And then what you want to do is you want to write up an exam based on that extremity. So if it's a hand, you want to do a hand exam. If it's an elbow, you want to do the elbow exam. If it's a shoulder, the shoulder exam. If it's a hip, you want to do the hip exam. If it's a knee, you want to do the knee exam. And I would suggest you write up some most common areas that people have problems with, whether it's, you know, and you want to have a sheet of paper that you can pull out that has all of the orthopedic and neurological exams for a hand, and for somebody's elbow, and for a shoulder problem. And it's much easier to check off the list and say that you did Codman's, and say that you checked for rotator cuff tenderness, that the range of motion was restricted on abduction and flexion. You know, these are important because these findings are going to get better as you go through this process, and you want to be able to show the person and the insurance company that you've made results, that you've made improvement. And if you don't document that stuff and you don't have an easy way of doing it, you're really going to not, it's not okay to do that. And people expect that thoroughness. Believe me, they do. So once you've done that and you've looked at the area, you always ask if there are other areas that you have a problem with. We might as well treat them, you know, address them now while you're here, and then you would do a focused exam on each one of those areas. Okay, at the end of this, what you're going to do is I would explain at that point how the laser works. Oftentimes, I will explain how the laser works at the very beginning before I even examine them, or you can do it after the examination. It's really up to you, but you have to give an explanation. I would probably do it at the beginning before you actually get in and do the history and everything else. One of the effective things you can do is when they first come in and you have you come into your consultation areas, you set them down and have them watch that video, okay? And the video really should, there's one on the internet that really talks about how it affects tissues and how it changes cells, and that's important. And then the one, when you do the closing and you're going to do the financial, you show them the one with that orthopedic surgeon. I usually show an informative one in the beginning, and then I show it with the orthopedic surgeon at the closing of the financials. The video that works really well for the first visit is that ML830 video where the guy's golfing and he shattered his knee in the accident, and they have the physical therapist. It's available on YouTube. It's the golf video. I could show it to you, but so that's, sometimes I'll show them that first when I walk in, and then I'll do my exam, take the x-ray, and then I explain to them that we're going to go over the report of findings when you come back in tomorrow. This is important. Please bring in your spouse. As I told you before, it's very important that your spouse is here because you have to make a decision on this, and I want you to know that if you'd like a laser treatment tomorrow, the cost is between $75 and $150 for a laser treatment. So you need to be prepared to pay for that tomorrow if you want to receive a treatment tomorrow. Okay? And of course, if they have any insurance, they've already given you their insurance card up front, your girl has to qualify that insurance before the second visit. You cannot go into that report of findings without that insurance information, because that's the first thing they're going to ask. Does my insurance cover it? I want to know how much I have to pay. And if you don't have that information, you cannot move forward from there. So that's really, really important. Okay. They go up front, they make an appointment, and it's all good. So they'll always come in for that second report of findings because they want to know what's wrong. So the person comes in for the second day of the report of findings. Hopefully they have their spouse or their significant other with them. And you explain to them that today you're going to have a report of findings, and it'll take about 20 minutes. The doctor will go over the exam findings, the x-ray findings, and then he'll inform you if he thinks he can help you, if he's willing to accept your case, you know, that the laser can actually help the person. Okay, so at that point, the person has gone into your report of findings room, and that's where you have your model of the, you know, you have a sample laser there. You have some, you know, that's when you're going to show them the, I wouldn't show them the video yet. That's where you're going to have your x-ray findings, and you're going to have your, I would write up a treatment diagnosis plan. And that plan is something that when they come in for that report of findings, you've already written down what is wrong with them, what your findings are and what your diagnosis is, and then you're going to write down how many treatments you feel you need to do to either give relief to the problem or to completely resolve the problem. They should be two different numbers. Okay, so you give the person two choices. But and then you have that on typed out on a sheet of paper, which says laser services for non-insured patients, and let them know the price of the laser visit is $150. This is your diagnosis. This is your treatment plan. I'd like you to come in for 3 times a week for 2 weeks, which is 6 visits, and then twice a week for 8 weeks. So that's 10 weeks basically. And you will notice relief and results hopefully within the 5th visit after using laser services. The first couple visits could aggravate it a little bit because it wakes up the nerves and it wakes up the nerve endings, and might feel some discomfort, but please don't let that alarm you. The 3rd, 4th, 5th visit, typically we get 50% relief and improvement in range of motion. You get decreased inflammation, and you also get decreased pain every time you do the laser visit. So 5 is the, we really have to look at that if it's working, but I do believe it's going to take up to 3 times 6 plus 8, about 14 visits to see if we can resolve this problem for you. And we'll talk about it at the end of the 14th visit if we need to do more. Now, the way I would price it is really very simple. There's $50 laser visits, there's $100 laser visits, and there's $150 laser visits. Okay? The $50 laser visit is a wrist, an elbow, a hand, a heel spur, a Morton's neuroma in their foot. The $100 visit would really be the lower back, the knee, one area, the shoulder, somebody's ankle and hold their whole foot. And then the $150 visit is really when you do multiple areas. You're doing somebody with a low back problem and sciatic. They have low back and they have, they have multiple areas. They have their neck, their lumbar spine. Maybe you've got to do the sciatic nerve. The nerve in their arm is inflamed. And always remember when you do laser services that you always want to do it. You always want to do it where they hurt. You don't want to do it anywhere else. They want you to apply the energy where they hurt. Okay? Now you can always do the cervical spine because that's where the nerves begin and that's where they generate. But then you want to do it down the arm if it's a neuropathy, if it's radiculopathy in the arm. You want to do it wherever the nerve hurts. And you want to make sure that you know that they know and you know that you're on the same spot. Because a lot of times you're not listening, you're holding it on other areas, and they're hurting, and you're not doing it where they want it done, and they'll call you on that very, very quickly. I would start out people that are in a lot of pain. I would start out at a 3.0. Don't go higher than a 5 for at least the first 2 visits. The 3 levels, 3.0 and less, is really analgesic. It stops pain. It gives a numbing effect. Anytime you go higher than a 5, I would never really go higher than 7. That laser that you have, if you run it at 9 all the time, you're going to burn out the module as I've done in the past. So you really want to keep it at a 7. And the 7 is your Mac Daddy. I'm going to do the lumbar spine. I'm trying to penetrate the laser energy down into those tissues. I'm going to trace the sciatic nerve in the buttock and the gluteal. Down the sciatic notch, you're going to trace that nerve down through the hamstrings, where it wraps around the lateral portion of the leg there by the I know the name of that spot, by the anterior tibiofibular notch up there, and then it's going to go down, into the calf and into the front of the anterior compartment, and that nerve goes down the feet into the toes. So you really want to trace those nerves where they're close to the surface, and the people will feel it tingle as they go down, and that's usually a good thing. Don't keep asking them if they feel anything, because a lot of times they're not going to feel it. And if you keep telling them, do you feel this? Are you feeling the heat? Are you feeling it? You're kind of making them believe that that's a requirement for it to work. And if you keep telling them that, you're going to get people that say, it's not doing anything. I'm not feeling any heat. They're expecting it to have heat. If you tell them, it's going to hurt. So don't tell them, and you'll do much better. Class 3 lasers, they feel nothing ever, and they get better. So we've made that mistake of always asking them how they're feeling, how they're feeling. Now, in your mind, for you girls that are doing the laser services, the ones that are holding the laser there, okay? You don't ever want to hold the laser in one spot. You want to move it. It's kind of like painting with a brush. So you want to, the area where they're hurting, if it's the size of of an egg, let's say, you want to treat at least 6 to 8 inches around it. And you really want to focus that energy where they're hurting, but you want to treat the area around it also. That brings nutrition and blood supply into that damaged tissue. So that's why you want to treat around the area. And you have to picture in your mind that you're flooding. It's called drenching the tissues. You're drenching as if you would drench something with water. You're flooding the tissues with light, and it has to seep into the tissues. And it takes time. You can't, the first time you do the laser, if it's too strong, the body reacts and doesn't want the light, and it will cause pain. So you want to start out at the lower levels first, 2s and 3s, and then as you do the laser more, you can do more treatment. Now, the way that you get the laser energy down deep into the tissue is through repetition and through doing it very slowly. If you try to turn the power up too quick to get it in there, it just spills out. And a good analogy would be that of a garden or a dry ground. If you came to the dry ground and you decided to water it the first time and it's been a drought for all summer long, the ground's going to be very hard. It's not going to absorb the water, and the water's going to spill off. But each time you put the water on it, each day you do it, a little bit more seeps in, a little bit more seeps in, a little bit more seeps in, until finally the water gets down to the roots of the plant. So it can take, 5 or 6 days to get the water down to the roots on ground that's very dry. And that analogy is a great analogy of how the laser seeps the light into the tissues. You have to drench the tissues with photons. If those photons do not reach the area where they hurt, you will not have a healing. It's that simple. That's why shallow lasers only work to a certain extent. The deep tissue lasers will penetrate, easily about 1 inch to 1.5 inches, but they can go down as far as 3 to 6 inches over repeated treatments at the same spot for 10 to 15 minutes holding the laser there. So if you've got somebody with a low back and a disc problem, and the nerve roots are inflamed, and and it's in their low back, those structures are 3, 4, 5, 6 inches deep. You have to do at least 10 to 15 treatments to the area of L1 through L5 and the paravertebral muscles, and you're going to have to do at least 15 to 20 minutes of laser energy at between 5 and 7 to get enough photons down to those deeper tissues to make a change. All right. Shoulders really respond amazingly well to laser, but you have a few areas that you must focus on where they have damage, and typically it'll show up on an MRI. It's called an impingement syndrome, or the rotator cuff has been torn, and the rotator cuff is going to be right up here on the shoulder, and the impingement syndrome is going to be out on the periphery here, out where the AC joint comes up and pinches there. And you want to focus on those areas first, but then you want to do the deltoid muscle. You want to do the whole back scapula, the infraspinatus, the supraspinatus, the teres minor and major down low in the scapula. And then you want to do under the armpit. You want to shine the laser up under the armpit. Sometimes I'll have them put their arm up like that on their side, and I'll get up under the armpit, down into the scalenus muscles here. And you always want to do the traps, and you want to go up and into the neck anytime you do the shoulder. So shoulders can take 15, 20 minutes to do a really good shoulder treatment. And you don't want to do it at these high depths, a high power. You really want to keep it between a 3 and a 5. Shoulders are shallow structures. You're not penetrating that deep, so you don't need those higher powers. And it also helps if they move their shoulder while you're doing the service. So, you have them lean it back for a little bit, then you have them bring it forward. Any movement, because it's a dynamic healing device, when they move it, sometimes you can get better results when people move it. When you do knees, it's very effective at knees. However, people that have really bad osteoarthritis, where the knees are like melted together and they're nodular and you feel the bumps, and they're really candidates for knee replacement, or they've had it for 10 or 20 years, the results are very slow with it. People that have recent knee problems that have had some pain and they're still movable and walking, they get a lot better results when we do the laser to them. The knee, again, you want to focus on the area where they're hurting, which would probably, they will point to it. Sometimes it's on the prepatellar, the patellar tendon there, right above the tibia. Oftentimes it's on the medial collateral ligaments, the lateral collateral, and a lot of times they have pain behind the knee. So, you're going to have to turn them over on their stomach, and you're going to have to use the laser in the fossa, in the popliteal fossa there. And knees take time, You really want to do the laser in a large enough area as if they had a knee brace on. When they put a knee brace on and it covers the bottom of the femur and the top of the tibia, that's how large of an area you want to treat with the laser. Remember, the deep tissue laser, you want to focus where they hurt, but you need to spread out the areas around it, and you need to time it. So if you've got 18 minutes, 15 to 18 minutes to treat a knee, you want to split it into two, 8-minute times. So you want to treat the front of the knee for 8 minutes and the back of the knee for 8 minutes. You got to split it up so it's even. You don't want to put all the time in the front and run out of time for the back. And that's really where skill comes into play. Cervical spines, chronic arthritis in people's neck, osteoarthritis responds really well to deep tissue laser. People feel the heat in their neck way before they feel it in other areas. So be careful when you do necks. You want to lift up the hair. You don't want to do it through the hair. You want to get the skin there. The hair diffuses the light. So you want to get the hair out of the way. You want to expose the shoulders, pull the shirt down. Make sure you get down to T2. You just do the neck on both sides. Whenever you do, people have pain in their middle back, you would lift their shirt up with their face down, and you would apply the laser to the paravertebral muscles at T6, T7, T8 on both sides. These are fairly easy areas to treat. I would keep it at a 5. If you're doing toes and feet and heel spurs, man, it really works amazingly well on people's feet. It's just a miracle. If somebody's got Morton's neuroma, where they've got pain between the 4th and the 5th metatarsal, the laser is just rocks. 3 treatments and it's done. So you better have them prepay, because after the 3rd treatment, they're probably not going to come back. Heel spurs get a lot of relief, but if someone has a chronic heel spur that's really affected them for several years, it takes quite a few treatments. But if it's a new injury and it's a fairly new one, it can work really good. It works for neuropathy. People that have pain and tingling in their toes, pains in their feet, pins and needles. You lay them on their back, you take off their shoes, their socks, and then you would actually do the laser to both feet just like they were wearing a sock. So you would do it to the sole of the foot, the toes. Always focus where they're feeling it the most. And then you would also do the upper ankle, just as if they had a sock on. And you really don't need to go up much higher than that. If they don't respond to doing it on the feet, then you need to move up to the lower back, because it's probably a radiculopathy from their lower back. Everybody can be under chiropractic at the same time. It's never a problem. That's really kind of tells you a lot about it, of where it works. When I explain the laser to somebody, they ask me how it works. It's really very simple. You have to remember there's 3 basic features of a laser, what it does. One is that it's anti-inflammatory. When you apply the laser energy, the photons, it reduces inflammation by a series of chemical reactions. The laser energy stimulates the cell, the mitochondria, to produce ATP, and then it produces the byproducts of a supercell. And that supercell brings down, it's an anti-inflammatory effect. Every time you use the laser, there's an anti-inflammatory effect. The second most prominent feature of the laser is it's really good at pain relief. It gives analgesic relief right away. Most people, after the 3rd or 4th treatment, remember, you need to keep the laser low in the beginning, 3.0, otherwise you're going to kick up some pain. But once they start feeling better past that third and fourth visit, it reduces their pain by 50% every time. The third most incredible part about the lasers, about these deep tissue lasers, is that they are biostimulatory. And what biostimulatory means is they can stimulate the cells to become a supercell, which means it heals rapidly. So you can increase healing time. You could half what would have taken 6 weeks to heal, you can do it in 2 weeks with a laser. What would have taken 3 months to heal, you could do it in about 6 weeks with a laser. And those times are important to people because they want to get back to doing what they want to do as fast as they can. It works really well on young athletes that strain and sprain their ankles, the girls that play soccer, people that strain their knees. Acute injuries work really fast with it. It's the chronic ones that they've had for a long time that are more complicated. So they're anti-inflammatory, they're analgesic, and they're biostimulatory. You know, they use a lot of lasers now to regrow hair. And one of the ways laser energy works is it increases protein synthesis. And protein synthesis is what the cell's job is. Every cell in your body produces proteins. It has a job, and it's called protein synthesis. And laser stimulates protein synthesis. And it also stimulates a new capillary growth. It increases blood flow to the area. It also increases it pushes away waste products. So in essence, it super heats and super heals the tissue. One of the ways that I explain why you need laser and how effective it is to explain to people that your body is made up of billions of cells, trillions of individual cells. And a cell might be a muscle cell, it could be a blood cell, it could be a nerve tissue cell, it could be a bone cell. They understand that we're made up of individual cells. Okay? And cells all need the same type of food to live. Okay? The food comes from what you eat. When you eat food, it's digested, it's turned into macronutrients and then into micronutrients, and then it's turned into glucose by the liver. This glucose is what we call blood sugar, and this is the only food that a cell can use as energy, is glucose. And that glucose is pushed to the cell through the interstitial tissues. And that's through the fluid, through the lymph fluid, through the clear fluid. The cells absorb that nutrient, and then what they do is they do their job, which is to make protein, and then they expel the waste product, and your body removes it through the natural lymphatic system. And this is how your cells live every single day. They get food from the periphery, they do their job, they get rid of waste products. Now what happens is when you suffer a crushing injury, a blow to the joint, when you take a leg joint or a knee joint, you twist it, when you have somebody punch you in the arm, when you suffer a surgical incision, when you suffer an area that has lost blood flow, what happens is you have tissue damage, you've hurt yourself. And one of the things that happens is the first thing is your body produces an inflammatory reaction. And that inflammation is what you call swelling, but we doctors know it as blood flow coming to the area, white blood cells coming in to help clean up and heal the tissue. We also know as doctors that inflammation that goes on for a long time can also reverse and slow down the healing process. It impedes healing. The same swelling, which is to heal your body, impedes healing. So when you go to the physical therapist or you go to the medical doctor, they do techniques and they give you pills and drugs to reduce inflammation. That's what heat does. That's what ice does. That's what muscle stim, the therapies they apply at the therapist office do. That's why they give you anti-inflammatories. That's why they give you injections, which are steroidal anti-inflammatories. They're trying to reduce the inflammation so the body can get fluid to the area and heal itself. Now, what happens is oftentimes those medicines and procedures are dangerous. They have side effects. They sometimes cause other areas to become damaged in an attempt to heal the one area. And we know that the results are not great afterwards. And what's really great about lasers, and this is really important to understand, is that the laser energy bypasses the inflammation. It doesn't care that there's inflammation there. Those photons of light, when you apply it to the area, go right through that inflammation. and they don't attack, they feed the cells that need the help. The cells which have been damaged, the cells which are not getting the glucose, that can't function, will utilize the photons of light and kickstart their metabolism. So you're literally feeding tissues which are starved of nutrition, which is why they hurt. You're feeding them with light. And what's really great about light is it doesn't damage things in the process. What do I mean by that? It doesn't hurt the tissues that don't need it. In your body, when you have swelling and pain, only some of the tissues hurt. There's other tissues around it that are in good shape and they're working fine. And when you apply light to that area, those cells are not affected. Only the cells that need the light absorb the light. The rest of them, it just goes through them. So it has no side effects. Whereas a steroidal injection, when you inject steroid into somebody's tissue, it affects the tissues that need the help, but it also erodes good tissues. And that's why steroidal injections you only can have 1 or 2, no more than 3, or they won't do it again, because it leaves holes in your body. And the same thing goes with ultrasound to reduce inflammation, and that can damage other areas, unintended areas. So that's one of the really amazing parts about laser light. The other amazing part is that our tissues respond favorably to only certain wavelengths. And these are what we call the golden light. And that's between 635 nanometers, which is red light, and 980 nanometers, which is called near infrared. So some of the lasers we use red light. Others use infrared light that you can't see with your eyes. And the reason why is colorless light penetrates deeper into tissues than colored light because it doesn't have the same mass. So they find you get really good results when they mix the two colors together, which is why our lasers, you see that red light, and then you don't see the other light. It's an infrared laser. The other thing is, if you don't think anything is coming out of the laser, all you have to do is take a cell phone, iPhone, put it on camera, and hold it up to the wall and shine the laser on the wall, and you will see the laser beam coming out of that machine, because cameras are sensitive to the infrared wavelength that your eyes can't see. And it shines all around the room. It bounces against white things, so everybody has to wear those lights when they're in there with the laser is being operated. That kind of wraps up what I know about lasers and how we use them in the office. I'm sure I hope you play this back again and again and let the staff see it. It's a trial and error. You never really hurt anybody, but sometimes they don't get relief as fast as you'd like. So you really have to work with the different power outputs. It's okay to go from 3 to 7. You don't have to check with the doctor to do that. But if anybody's having pain afterwards and it's aggravating things, you need to talk about that right away. You have to be really careful not to apply it to areas that you have not examined. It's really common for patients to say, I've got 15 visits and 10 has worked here. Do you think you could apply it to this part of my foot now? And if you haven't examined it, the rule is the staff can never apply it to any area other than what the treatment plan that was determined by the doctor has been authorized. Okay? I would suggest you keep a sign-in sheet, a log book, and every time you do the laser service, you write the date and you write the patient's name and you write the area that you treated and you write down what visit it is, if it's the first visit or the second visit or the third visit. It's important after you do the laser service that you document it in the computer as a SOAP note. This is not something that should not go in the computer. This is a visit by the doctor, and you have to have SOAP notes. And the doctor shouldn't have to write that down for you. As a laser tech, you're going to go to the computer, you're going to go to where the SOAP note entry is, and you're going to write down how the person was feeling that day, if the pain is worse, better, or the same, where it is. And then you want to write down if you noticed it was red or is the swelling going down, what you saw visually. You're not expected to palpate or to touch the area. You leave that up to the doctor. And then you want to write down what the wattage was, what number you chose to treat. So if it was 3.0 watts, you want to write down 3.0 watts for 15 minutes applied to the right elbow. Okay? Treatment number 2. The next day, and then you want to put the charge in. You got to put in the code. There's no code for lasers, but you want to make sure that you put in that you did the service. And you also want to maintain a logbook, a log sheet next to the laser, so everybody that does it, so you never get mixed up. If they don't get documented in the computer, you've got your log sheet to look at to see that they came in on that day. And also, if your tech's not there, and someone else is doing the laser, they can go to that log sheet and they can see the area that you've been treating and the power you're using, because you want to duplicate that, and that's really important. And you would do that each and every time they come in. You should examine them at the midpoint. Okay, the doctor should come in, see the patient, see how they're doing, check the range of motion, check the tissue function, do a little exam for them. And this way you're not going to lose people in midstream. And then at the end of the plan, when the laser visits are done, the doctor needs to go in, do another exam, check the results, go over the pain. You do another pain questionnaire to see where they are with their pain level. And if it's not resolved yet, don't freak out. Sell them more care. It's that simple. You need more than we thought. It's your problem is more complicated than we realized. I'm sorry I underestimated. I didn't want to overestimate and miss the mark, so I underestimated it. So what we need to do now is we need to do it once a week for the next 8 weeks. And the cost is X, Y, Z, and let's get started. So the biggest issue that happens is when they get near the end of their plan, the doctor doesn't want to confront them. Maybe it didn't work. He feels, like he's going to piss them off or something. You don't ever want to do that. If it didn't work, it's not your fault. It's an estimate, and you missed the mark a little bit. People understand that. But if you don't go in there and talk to them, if you don't go in there and find out what's going on, then they do get angry. And then they won't come back, and they won't send other people to you. So what else do I do with that? That's really about it. You know what else we found was pretty helpful is we took pictures of a person's extremity of their knee, of their shoulder, of their back, and then we were able to, on the picture, we were able to mark where we did the laser treatments. And we kept that photo record in there. So anytime somebody came back and they said, well, where did you apply the laser? Well, we have a picture of it, and we used the paint portion of the notepad to make little dots where we apply the laser. We trace out the area, and then we hit the text box, and we type in under the text box, 3.0 watts for 10 minutes, 12 treatments, and we make a little plan on that picture. That's been very helpful too. Okay, I think that's enough for now. I wish you luck. It works, and have fun.